Hello everyone, welcome to the online class of Chinese medicine gerontology. Today we will study the chapter Common Disease Syndrome in the Elderly, Senile amyotrophy. First, learn the definition of senile amyotrophy and the understanding of Chinese and Western medicine. Amyotrophy, also known as sarcopenia or muscle volume loss, is an age-related decrease of muscle mass and negatively affects the body's stress, metabolic rate, function, etc., and ultimately leads to a decline in quality of life. Sarcopenia is closely related to activity disorders, falls, low bone density, and metabolic disorders, and is one of the most important reasons and manifestations of the gradual decline of physiological functions in the elderly. Sarcopenia will increase the hospitalization rate and medical expenses of the elderly, seriously affect the quality of life of the elderly, and even shorten the lifespan of the elderly. Amyotrophy belongs to the category of dystrophy of traditional Chinese medicine and refers to a disease syndrome in which the muscles and veins of the limbs are slow, weak, and will not be used for a long time, causing muscle atrophy or paralysis. Modern medicine believes that the pathological mechanism of senile sarcopenia is complex, and multiple risk factors and mechanisms are involved in its occurrence. The first is internal factors. The most important thing is that the synthesis of hormones, such as testosterone, estrogen, growth hormone, insulin-like growth factor 1, in the elderly is reduced, which reduces the synthesis of muscle protein. At the same time, the activity of muscle fiber apoptosis is enhanced, and the pro-inflammatory factors are increased. Oxidative stress caused by basal accumulation, changes in mitochondrial function of muscle cells, and a decrease in the number of alpha motor neurons, all result in increased protein breakdown of muscle cells, which ultimately leads to catabolism greater than anabolism and reduced muscle mass. The second is external factors. Protein malnutrition is one of the most important factors. Decreased intake of vitamin D or insufficient synthesis capacity can lead to decreased muscle mass and decreased function. At the same time, due to factors such as decreased taste and smell in the elderly, poor teeth, digestive and absorption disorders, depression, or medication, it is easy to cause food deficiency or anorexia, resulting in insufficient nutrition intake and decreased absorption rate. A lifestyle with reduced activity can also cause loss of muscle protein. The elderly also often suffer from dysfunction of various organs of the heart, lungs, liver, kidneys, and brain, inflammatory diseases, malignant tumors, or endocrine diseases, which further exacerbates the disease in muscle volume. Chinese medicine believes that the disease is mostly caused by exogenous factors, such as warm and poisonous heat, internal injury, emotions, dietary fatigue, and bruises, etc., resulting in asthenia of the 5 sound organs, insufficient fluid, depletion of qi and blood, and loss of muscle tendons. The lesion is in the tendon muscle, and the lesion involves the spleen, lung, liver, and kidney. The basic pathogenesis is fluid loss, qi and blood, and loss of essence, which cannot support muscles and veins. The spleen and stomach are weak and cannot function well. The qi and blood are lack of essence. The muscles and veins are losing support. The disease is weak for a long time. Liver and kidney are deficient in blood and essence, and the muscles and bones cannot be supported, so that the limbs, muscles, and bones are too weak to use. 一宗必读伟 said, Yang Ming means the stomach. Accept the food, sublimate to nourish the surface and inside. So it is the sea of internal organs, and then nourish the muscle and tendon, mending the bones and benefits the organ. Yang Ming deficiency means that there is less blood and qi, and it can't nourish Zongjing, so Zongjing relaxes. Zongjing's longitudinal veins can't be retracted, so muscles of legs are lost. Next, we are going to talk about the diagnosis and central differentiation of sarcopenia. The diagnosis of sarcopenia is achieved through the following evaluations. Number 1, the pace test. If the pace is less than 80 cm per second, the muscle mass will be further evaluated. When the pace is faster than 80 cm per second, the hand grip will be further evaluated. Number 2, when resting, the dominant hand grip thrust is normal for male greater than 25 kg, for female greater than 18 kg. Then sarcopenia will be excluded. If the muscle stress is lower than normal, the muscle mass should be further evaluated. Number 3, if the muscle mass is normal, sarcopenia will be excluded. If the muscle mass decreases, sarcopenia will be diagnosed. Sarcopenia belongs to the category of dystrophy in Chinese medicine, and its main points of differentiation are distinguishing deficiency and excess. Anyone who has an acute onset, develops quickly, has weak limbs, or is long limbs, and in apparent amyotrophy, it is an excessive syndrome of long heat injury or humid and hot indulgence. The disease gradually develops, the limbs move slowly, and the amyotrophy is obvious, which belong to spleen, stomach, liver, and kidney deficiency. Now, let's learn about the specific central differentiation and treatment of sarcopenia. It can be divided into the following 4 common syndromes: the syndrome of heat and lung injury, the syndrome of dampness and heat, the deficiency of spleen and stomach, and the deficiency of the liver and kidney. Except the acute onset of lung heat injury syndrome, the onset of other syndrome types are slow. Except for the lung heat injury syndrome is excessive one, damp and hot indulgence is intermingled deficiency and excess, and the other syndrome types are deficient syndromes. The main features of lung heat injury are thin muscles, dry skin, upset, thirsty, yellow tongue with red fur, and pulse count. The main features of damp and hot indulgence are heavy limbs, weakness, big red tongue with thick yellow fur, and thin snow paws. The main features of weakness of the spleen and stomach are the gradually advanced weakness, the fatigue of the limbs, amyotrophy, the fat tongue with thin white fur, and weak paws. The main features of liver and kidney deficiency are weak waist and knees, cannot stand for a long time, or even walk completely abolished, red tongue and less fur, pulse count. In terms of treatment, according to central differentiation, clearing away heat and dampening lung, or clearing away heat and dampness, or strengthening spleen and qi, or nourishing liver and kidney. It can support right and remove evil, restore fluid, qi, and blood essence, and nourish muscles and veins, improve muscle atrophy. The representative prescriptions and the addition and subtraction of medications are as follows. The first is 清燥救肺 soup. This prescription is meaning a certificate of heat and lung injury, which can clear dryness and moisturize the lung. Among them, more sangye can clear away the heat and dry in the lung as a keen medicine. 石膏 clearing away lung heat. 麦冬 nourishing qi are ministerial drug. 人参 benefiting the stomach and nourishing the lung. 麻仁 阿胶 nourishing the lung. 杏仁 枇杷叶 lowering the lung qi. These are adjuvant drugs. In this way, the dry heat of the lung can be cleared, and the upper of lung qi can be reduced and lowered. So the name is 清燥救肺. The second is 加味二妙散. 二妙散 is composed of two herbs, 苍竹 and 黄白. It has the functions of clearing away heat and dampness, and ending 牛膝、当归、泽兰叶、薏仁、乳香、没药、穿山甲、水蛭、甘草 into 加味二妙散. To eliminate evil heat, help qi and blood circulation, promotes the circulation of qi and blood. The third is 参苓白术散 and 补中益气汤. These prescriptions are representative prescriptions for treatment of spleen deficiency, and their function is to strengthen the spleen and qi. The spleen and stomach are full of qi and blood, and the tendons are moisturized. The fourth is 胡浅丸. It has the effects of nourishing in and reducing fire and strengthening muscles and bones. It is mainly used for treating liver and kidney indeficiency, sore wrist and knees, weak muscles and bones, weak legs and feet, struggling steps, red tongue with less fur, and weak paws. Among them, 黄白、熟地、知母、龟板、白芍, lowering the fire and cure its roots. 虎骨 and 锁阳 can strengthen muscles and bones to cure its symptoms. 干姜 and 陈皮 to warm the spleen and stomach and circulate qi, and the bitter cold of the main medicines such as 黄白. 牛膝 attracts medicine downwards, and mutton to warm the stomach, which has the effect of diet. The whole party played together to nourish in and reduce the fire and strengthen the muscles, in addition to traditional medical treatments. Sarcopenia emphasizes comprehensive treatments, such as exercise therapy, nutrition therapy, vitamin D supplementation, and rehabilitation therapy. Special emphasis on exercise is one of the most effective means to maintain muscle mass and stress. Exercise is essential. Well, that's all for today's class. Thank you all.